Good evening, everyone. Let's try that again. Good evening, everyone. Good evening. Oh, much better. Thank you so much. Thank you so much. I am Danet Lapis Bloom, the Region Chair of the Philippine American Chamber of Commerce Central Texas Region, otherwise PACC-TCTR. Even the abbreviation is long, right? So I thank everyone for coming here today. Today we're gonna talk about how to get to the moon. Oh no, Medicare 101, correct. So how this came about, we asked our membership at our General Assembly and end of the year party as to what would be the things they want to listen to or learn during this networking session. So we value our networking with each other, but it's also good to learn something from it, right? So our members said that we want to learn about Medicare 101, and that notion, that request transported me back to a meeting I had with Filipino Americans in Arizona, where they have a meeting. I have a national project to engage and build capacity and engage Filipino Americans for their health. And there was this doctor that joined the Zoom late, and she said, "I'm so sorry I'm late. I'm retiring soon and I have to learn about Medicare." My gosh, it's so complex. I'm not sure how lay people actually understand it, because even me as a healthcare provider, it's very complex for me. And so they, in turn, actually had a session to just provide an overview of the Medicare program. That with the caveat that each individual's situation is different. The conditions you have, your finances, your like previous work history, and so on and so forth would be different. So you really need to talk to someone who is an expert who would be able to take you through. But a little bit of understanding of what the program is I think is very, very important. So it happens that I have a compadre here, Bernardo Ortegon. Let's give him a round of applause. He worked for USAA for a number of years, right? Certified chartered financial consultant. So we're up for big words tonight. But he has worked in this capacity for Medicare to really kind of help guide patients into the different programs there is. So maybe you've heard of Aetna or United Healthcare, so they're very specific programs. So he is able to actually talk to you about all these things because he's not married to one program. And for those who are Blue Cross Blue Shield, raise your hand up. I think it's one of those that's coming up, right? So I don't know if I forgot anything, Bernardo, so feel free to add more to your profile. And without further ado, let's welcome Bernardo Ortegon.
Thank you, Dr. Danet. It's in the 20 years that I've been a chartered financial consultant. It's also been a blessing that about 15 of those years had the blessing to meet Dr. Danet and her husband, Dr. Mike. So thank you for inviting me to be here. Today is just a very brief overview. Each brochure has my card to have a little bit more detailed conversations, if you will, on your specific situation. But today is just a brief overview as what is Medicare, who is eligible for Medicare, how can an independent agent like myself be of a resource to you and to this chamber. But know that this brochure is just very brief. It's a high-level overview. There are different brochures that I also brought along if you'd like more information. If we go through the more detailed information, that's over 2 hours. So we'll stick to the smaller one first. If we open the brochure, it's just going to be, again, a very high level. And of course, my business card has my email, my phone number. Preferred method of contact initially would be through email. I'd be more than happy to answer any follow-up questions that way. Page 2, basic concept. what is Medicare and who is eligible? Medicare is a federal program, and it's specific to a certain group of individuals. The first group is age-based, 65 and over. The second group is they have a specific medical condition that Medicare has deemed, independent of their age, they would qualify for Medicare. And you can read that about there at the bottom. Of course, it's limited to U.S. citizens or residents that have been in the States 5 years or more, but 5 years prior to immediately enrolling in Medicare. The key concept for the first page is that Medicare is an individual program. A lot of times in my clients, let's say husband and wife that are 65 and over are retiring around the same time. One of the key questions I get is, well, in my group plan, myself and the spouse is covered. Would this work the same way with Medicare? And the answer is no. Medicare, the key concept to remember on the first page is it's an individual plan. Next page, what does Medicare cover? And right away we come into the term original Medicare. Original Medicare has Parts A and Parts B. Part A for Medicare is coverage for inpatient hospitalizations. The key phrase there, or the key word there, is inpatient versus outpatient. And skilled nursing care, which is when the doctor releases that patient from the hospital, an inpatient stay, but they're not quite released to go home, back to their apartment or back to their residence. They're going to get a prescription for rehab care. That's the skilled nursing care. Part B is where I spend a lot of time with my clients to get to really understand their specific doctor, specialist, any type of diagnosis that they might have. So Part B covers your doctor's visits. That's where a lot of times the rubber meets the road for Medicare. Doctor's visits, specialist visits, and anything that is labeled outpatient care. Now, when original Medicare was originally was started, it was only Part A and Part B. So if you notice, we haven't talked about prescription drugs, prescription drug coverage. So if you hear the term original Medicare, that's just Part A and Part B. Part A, again, inpatient hospitalization and rehab care. Part B is doctor's visits, specialist visits, and outpatient scenarios. So now,
the ER fall under? ER, if you go to the ER, but you don't get into the hospital, where does it fall?
Emergency room.
emergency room care, correct.
Which is it A or B?
Well, so A would be inpatient. You would have to be deemed inpatient, so it would be more of a B. Good question. And of course, be happy to answer any questions, by all means, afterwards or through email. But ER is correct. It's until the person or the patient has been going into an inpatient scenario, that's where Part A comes in. So now you notice the government kind of saw the gap, right? The original Medicare does not have Part D coverage, so they added Part D. D is pretty easy to remember because you can think of prescriptions and then D, drugs. Prescription drugs, that's your Part D coverage. To fill some of the gaps, and we'll get into those a little bit later in the following pages, but to fill some of those gaps, this is where an independent agent like myself comes in, because Medicare doesn't cover 100%. There's no health insurance plan that covers 100%. So now you're starting to look at what can cover some of the gaps for doctor's visits, for specialist visits, for anything that's deemed a diagnosis, diagnostic care versus preventative care. And you talk about those two different options at the bottom. Either a Medicare supplement insurance plan called Medigap, or a Part C Advantage plan that's more of what the clients that I deal with are used to in their group coverage, called like a PPO. They're used to having a group PPO and they want something similar, that's the Part C. What I like to advise my clients is if you can think of Part C as a comprehensive, C is comprehensive plan, just like a PPO, like your group PPO. It covers your hospitalizations, it covers your doctor's visits, and inside the same plan for comprehensive, it includes your prescription drug coverage. As we go to the next phase, this page alone, we could spend hours, but just really covering what are the coverage options. We start again, in order to enroll in any type of a plan that might fill some of the gaps, a Medigap, Medicare supplement, or a Part C PPO plan, you have to start off with original Medicare. The client has to be enrolled in Medicare Part A and Part B to think about enrolling in a Medicare supplement or a Medicare PPO. The most common option when somebody's looking at a Medicare supplement would be the last option. You have original Medicare. This is at the bottom of page 4. You have original Medicare as your foundation. Now you add a prescription drug plan, and then to fill in some of the gaps of Part A and Part B, that's where the Medicare supplement or Medicare, the Medigap plan comes in. Again, that's the most common option if they go to the Medicare supplement route. Part A, Part B, you have to have that. Part D, drug coverage, which is standalone, and then a Medicare supplement or a Medicare Medigap. Now, when somebody's about to choose their enrollment, you can go to a Medicare supplement and pay extra for that, and I'll get into a little bit why those cost extra, or you can get into a very, very economical but very robust here in Bexar County Medicare PPO. And Medicare PPO, again, is the Medicare Part C, the Medicare Advantage, which we're now on page 5. So again, with a Medicare Advantage of Part C, you're getting a comprehensive plan. If you have a group plan at work, you're used to this. You have a plan that covers your hospitalizations. You have a plan that covers your doctor's visits, specialist visits, diagnostic care, preventative care, and you also have a plan that covers your prescription drugs. So that's what the Part C plan is. Page 6 and 7, not going to spend a whole lot of time because I would imagine most of us are familiar with these terms. Deductible, co-insurance, co-payment, and premium. But the most common question I get is, for this type of concept, is what's the difference between copay and co-insurance? Copay is a fixed dollar amount. Easiest way to remember, copay, fixed dollar amount. Co-insurance means there's a percentage. The percentage is fixed, but it's a percentage of the total, so that can vary depending on what it's going to be covering. Again, copay is a fixed dollar amount. Go to the doctor and the copay is $30. That's your fixed copay. You have a diagnostic treatment, you're responsible for 10%. That 10% is going to vary. The 10% is fixed, but the dollar amount can vary based on what you're actually getting treated for. Okay, when can I enroll in Medicare? Again, the most out of my client base, 95% or more are aging into Medicare versus having a medical condition qualifying them for Medicare. So they're aging in at age 65, and if you can think of the 7-month period, if somebody's turning 65 in March, technically the government opened a window for them to think about starting enrolling back in December. So you take the current month and you go back 3 months, or you take the current month and you go forward 3 months. So you have a 7-month period, the current month, let's say March, and then you go back 3 months, so December, but now you go forward 3 months, so you have from December until June to make an enrollment decision for Medicare. Eligibility due to a disability, a handful of clients fall under that category. That's at the 25th month when Social Security has deemed them to be disabled, just FYI. When can I change coverage? My busiest time of the year for Medicare is during what's called annual enrollment. So annual enrollment is the government's way of saying the plan that you chose, you're not stuck with it for life. So every year you have the ability to review your plan. Let's say maybe your doctor has changed, your specialist. The most common scenario that my clients talk to me about during annual enrollment is my medications changed. Either I have more or I have less. Typically, unfortunately, it's I have more medications now. Does my current plan that I'm in cover my medications, or do we need to look at a different plan? So annual enrollment is from October 15th through December 7th. And again, that's the government's way of saying the plan that you're in now may have worked for this current year, but now for the next year, do you need to review your options? If you keep your plan, and some clients tell me, Bernardo, nothing has changed. No need to come over, nothing's changed. My current plan is working fine. It automatically renews to the next year. The clients that I spend a lot of time with, again, are my specialists are changing or my medications are changing. Let's take a look. And that's where, again, an independent agent like myself, not tied to a particular company, but we do have contracts with the major companies, so we can look at a plan with United Healthcare, Aetna, Humana, and again, coming pretty soon to my book of business would be Blue Cross Blue Shield. Those are the four. I have a few other smaller companies, but those are the major ones that I deal with. At the bottom, it talks about special enrollment periods, and correct, somebody that qualifies for special enrollment periods, that alone would be about 45 minutes to cover all the special enrollment periods, but know that throughout the year there are special enrollment periods that somebody could qualify for, and they don't have to necessarily wait for annual enrollment that starts October 15th. December 7th is a firm deadline, unfortunately. Sometimes clients talk to me on December 8th and I can't do anything unless there's a special enrollment period. December 7th is a firm deadline. Next page, what if I work past 65? This is actually one of my most common scenarios. Somebody's aging into Medicare, but they're still working and they're still covered under a group insurance plan. My first concept is talk to your benefit coordinator to find out if your plan at work is going to keep you at 65, or sometimes I have clients that say, I've got a nice friendly letter from my benefits coordinator saying, I'm going to be dropped from my group plan. I need to go to Medicare. So the first concept I mentioned there is talk to your benefits coordinator. The most common response is, Bernardo, I can keep my plan, no worries. We can talk about enrolling into a Medicare plan right at retirement when they're going to lose their group plan. At the bottom of page 10, it's pay attention to the details. You don't want to be surprised that your plan at work is not going to cover you at 65 or later. But again, the most common scenario that I deal with is my plan will keep me covered and my spouse. I don't necessarily have to choose a Medicare plan now, and the answer is that's correct. We'll wait for you to retirement when that group plan is going to go away anyways. As Dr. Dan had mentioned, how do I choose? This is, again, we're working with an independent agent comes into play. Your health. I go into depth with what are your doctors? What are your specialists? What are your medications? Out of my book of business, about 10% of the clients, I only have my primary care and I only take one generic drug for cholesterol, and that's it. About 95% are, let me show you my list. Here's my doctor, here's my specialist, and here's my medications. So working with an independent agent, we can custom fit a plan that's going to cover the doctors, the specialists, the medications. And to make sure that if you have a preference for hospitals, to make sure that they're in the network also. Steps to enroll on page 12. The first concept is, I always mention, have you enrolled in original Medicare, Part A and Part B, yes or no? For most people, even if they have a group plan at work, they still enroll in Part A. Why? Because Part A is typically, for 99% of my client base, is zero premium. Zero premium because they've qualified for that 40 quarters of 10 years of payroll deductions. If you ever notice your payroll stub and you see Medicare being deducted, that's going into Part A. So if you have 10 quarters, 40 quarters, 10 years of those Medicare deductions, you are entitled to Part A at zero premium. Most people say, well, that's a no-brainer, right? I should start enrolling in Part A. My typical response is yes. Why not, right? There is no penalty if you decide not to enroll at 65 and you're still working into Part A, but get into the system, because when you start enrolling in Part B, it goes a lot quicker when you're already in the system. Part B is not zero premium. Part B is a premium-based scenario. Again, Part B is where the rubber typically meets the road, and I've spent a lot of time with doctor and specialist visits and outpatient care. For 2023, the standard premium for Part B is $164.90. I'm not a big fan of cents, so I just typically tell my clients $165 a month, per month. It's not free. Again, Part B, you have to pay. So it is also income-based. To go through those details, I can send you the PDF, but we would spend a lot more time. It's income-based. Higher earning individuals pay a higher Part B premium. The vast majority of my clients pay the standard premium for Part B. So again, $165. Not necessarily.
So when you say higher salary, is that salary your before you retired? Is that what you're referring
So
to?
what Medicare does is they look at the 2 years prior.
Okay.
2 years, because they figure that if you filed extensions and extensions and extensions, you're probably done with your taxes 2 years ago. So they look at your adjusted gross income 2 years prior. So if we're in 2023, they would be looking at your taxes for 2021. 2020, well, depending on the time frame. But they look at 2 years back, they look at your adjusted gross income as to what was filed for income-based adjustment upward. Again, the vast majority of my clients are the standard premium, $165.
Is that by choice or because they make income at 165? Do they choose to be standard or because that's what they make?
That's what their income falls under, yes. And again, I have the specifics that I can, if you send me an email, I'll be more than happy to send you all PDFs. If you have trouble falling asleep, there's a lot of PDFs that Medicare publishes that great for insomnia.
Is that adjusted each year?
That is adjusted each year. The standard premium for Medicare is adjusted every year, and so do the income thresholds get adjusted every year. There's publications on one of the resources I'll point out, Medicare.gov, or an independent agent. We can send you a PDF, and give you more information that way. Page 13 is actually where I spend a lot of my time with clients on their specific situation. And here's a concept. You're coming into the Medicare plan and you're paying already for Part B. You have to be enrolled in Part A and Part B. So you're coming into Medicare. So now the question is, do you want to go into what you're kind of used to at work, which is a PPO, and you're dealing with a typical PPO scenario? Are my doctors and specialists in network? Are my medications covered? And most PPOs here in Bexar County, the major companies have very robust PPOs, being a major metro area. Most of them in 2023 have zero premium, a zero premium PPO, because you're already paying for Part B. So they say, how does that work? I say, zero premium is exactly right, zero premium. We cannot say in Medicare as an agent, it's free. It's not, because out of your pocket is $165 coming out every month. So zero premium. Now, there are clients that say, you know, I don't want to deal with networks anymore. I've dealt with them most of my working life. Is there a plan that allows me to have no networks? As long as the medical facility accepts Medicare, Part A and Part B, they're going to accept a Medicare supplement, a Medigap. So now you go, okay, what's your budget? We know your health scenario, your specific scenarios. How does this look for you? And for my client base, it's almost 50-50. Some of them say, I'm used to a PPO, and I'm okay continuing that, especially with a zero premium and a robust PPO, where I know my doctors, specialists, and medications are covered. Perfect. The other route says, you know, I don't want to deal with networks, but oh, by the way, I also want nationwide coverage. My grandkids are in XYZ state, and sometimes we spend months with the grandkids. Here in Texas, you hear the term winter Texans. They might be coming from the north, but in the winter they're in the south. They have their group of doctors and specialists in the north, and they have their group of doctors and specialists in the south. So they go and they say, you know, it's in my budget to pay different plans, but about $120 extra a month to get into more of the supplement or a Medigap, so that I can keep my doctors and specialists up north and my doctors and specialists in the south. And oh, by the way, I know that anywhere in the country, as long as a medical facility takes Medicare, they're going to accept my supplement. So the budget, again, is, are you okay with a network kind of specific to a region at zero premium, which is perfect, or more of a Medicare supplement that is going to cover some of the gaps that original Medicare has, but now you have ultimate flexibility. If the medical facility accepts Medicare, you have nationwide coverage. If you were to say an estimate of the difference, it'd be about $120 extra, maybe $150, depending on which company is chosen and which plan. So that's where we spend a lot of time, is on page 13 with
So quick question with that one. For example, a patient has Medicare, chose the network one.
PPO?
Yes.
Okay.
So, and visits, that's the one that doesn't cover nationwide, right? Which one doesn't cover nationwide?
The PPO.
PPO. Okay, so based in Texas, goes to New York, gets sick in New York, what happens to that person?
Great question. So all Medicare PPOs have to have emergency care coverage. Have to.
So you got
So,
emergency.
but it has to be an emergency. Not, well, I'm getting a sore throat, I'm going to go check it out. So now PPOs are starting to respond with, if you're going to go on a trip, call us, and there might be network coverage where you're going, because again, United, Aetna, Humana, Blue Cross Blue Shield are national plans. They might cover, okay, go to a doctor over there, but emergency coverage has to be covered with a Medicare PPO. Has to. So does urgent care. Has to be covered at a specific copay or coinsurance. A Medicare supplement, you're good. As long as the facility covers, accepts Medicare. I mentioned that because in the 20 plus years, there's always a handful of facilities, and I don't know the reasoning, that do not accept Medicare. That means it doesn't matter if you have the PPO or they don't accept Medicare. I'm not sure why, but they have to, as long as a medical facility, which is 99% of medical facilities accept Medicare, you're golden on the supplement side nationwide. TRICARE for life, you're golden. You don't need Medicare. Yes.
You can adapt us there.
Yeah, so once in a while I do get military officer that retires. They have TRICARE for life. You're golden. The government is providing basically a Medicare plan for you at no cost, I think, right? No cost? Okay, it's a cost. But I would actually lose my license if I tried to say, hey, come on over to Medicare. No, you're golden. Federal employees that qualify for a specific age group, same thing. When they talk to me and they say, oh, the government's going to provide this at retirement, you are golden. No need to go into Part B and even pay for it.
What if you retire to another country, like in the Philippines?
It's right for U.S. Now, you travel to the Philippines, there is emergency care, but you have to pay first and try to get reimbursed. But if you move, then yeah.
There's also a hospital that's Medicare certified though in the Philippines.
If it's I would talk to them. I would find out.
That's what they,
Okay.
they're just commission certified.
Is that through the military or through the federal government? Okay.
This private hospital.
Yeah, it's a new thing that's ongoing because we're lobbying for it. Because there's a lot of Filipinos who want to retire to the Philippines, but the U.S. government is not very sure on how the quality and if it's trustworthy.
But they have, that's why they go through the deeming process for
Yes.
the commission. So if they're certified,
Yeah.
then they can take.
Good.
Yeah, and I think there's a couple in Manila and one in Cebu. But I think some people go to Guam actually to get the health care that they need.
So that's a good question. My understanding in normal situation is if somebody's going to go to another country to live there, then Medicare plan would not provide coverage. But I don't know about that particular situation. Maybe we can research it. Yeah, that's very interesting.
Yeah.
I'm used to military or federal employees.
If you
Yeah.
go to Costa Rica, they cover the Medicare there. Costa Rica and
Colombia.
Okay, so kind of, keeping it short again, my business card has my email, preferred method of contact for the initial one. If you want more information, I brought a more detailed brochure. This would take on a presentation over an hour, close to 2 to go over, but I have them. Or if you want, again, if you have trouble sleeping and you say, I want the full-blown 128-page brochure from the Center of Medicare and Medicaid Services, I can send that PDF. The basic concept is how can I help as an independent agent? I spend time with my clients. I get to know them, their specific medical situation, because I know that we need to find a plan that's going to be custom fit to their situation. There is no one plan that covers all medications. There is no one plan that covers all medical. If you go to the PPO route, there's no one plan that covers all doctors and so forth. So spend a lot of time with them. I can offer the major carriers instead of calling an 800 number and you're stuck with potentially that one. But also, where really the rubber meets the road as an agent is annual enrollment. Because as we age, I'm in my 50s and I'm already attesting to it, as we age, our medical situation changes. So as the doctors change, as the prescriptions change, that's where that annual review comes into play, which is vital for any Medicare plan that you're in. Because even if you choose a supplement, you're still going to have to choose a standalone Part D plan, and that's what may change. Typically on the supplement, I tell my clients, if it's still in the budget, you're golden on the supplement. I don't think we need to review it, but let's review your prescription drug plans. When somebody's in a PPO, we definitely review, are your doctors still going to be in the network? Are your specialists and your prescription medications?
What happens if you don't call? At the renewal time, if you don't call, what happens?
Your current plan automatically renews for the next year. And then you won't have the ability to review until, yeah. So I get this question a lot. So you're an independent agent, well, what's the compensation? So fundamentally, Medicare insurance plans are insurance. So insurance means commission. But here's the beauty of Medicare. Somebody can say, Bernardo, I'm going to go ahead and choose the zero premium plan. The 165 is going to go to Medicare, zero premium, PPO. You would think the commission's zero, right? Negative. The commission is exactly the same, independent of the plan that's chosen. That's precisely so that an independent agent or any agent does not have a specific bias to say, well, what about this plan that costs $120 so that the commission is higher? Independent of which way you go, zero premium or $120 a month as an example, the commission is exactly the same. So that's where an independent agent can come in and help you. But again, I'm available for questions. The card has my email. Please email me. Be more than happy to. I do have, just as a caveat, I do have a normal 8 to 5 job with benefits, right? But when I left USAA, actually a lot of my family members that were aging in were saying, can you help us with Medicare? And that's how I decided to keep my license, just insurance, not investments, and continue this on the weekends or in the evenings. So if you send me a message, I'll answer you by all means, weekend, evenings, during my lunch break, but I'm here to help. So.